Let's get some more insight from Dr. Peter Chin Hong. He's a professor of medicine and infectious disease specialist at the University of California, San Francisco. Peter, thanks so much for joining us. First, some information hasn't been made available to the public, like when was Trump's last negative test? How high did his fever get? How important do you think things like this are when it comes to understanding his current state of health and the possibility that others may have been infected?
Well, Roee, thanks for having me on. I think the lack of transparency about much of his medical records or his medical status so far is really has us all operating in the dark. I mean, there are essential things, like you said, that weren't mentioned. I think for me personally, not having mention of his chest x-ray or chest imaging is really critical because people can have minimal symptoms, but yet have a lot of abnormalities in the chest x-ray. That helps me as a physician stage him. If he has abnormalities, that means that he's actually on the way to getting worse. And right now, I think it is a waiting period.
Trump is now receiving a cocktail of drugs. A reporter was mentioning them earlier. Is this the same sort of cocktail that an average male in America his age would be getting?
No, I think Trump is getting many of these medicines in a special way. You or I, Roee, won't be able to have access to many of these medications, particularly the cocktail of antibodies. The way it was given, it was outside of a trial. It had to be through compassionate use protocol. And the remdesivir, if he truly wasn't on oxygen, as they say, most centers in the United States and around the world, if they have access to remdesivir, wouldn't give it in that situation. You'd give it when people are on oxygen.
At the press conference earlier on Saturday, it seemed that there were more pulmonologists there than there were infectious disease specialists. Does that tell you something about what's going on?
Yes, I think it suggests to me, just like the evasiveness about the oxygen requirements, it suggests to me that they're really worried about his lungs, which, of course, as the reporter mentioned, is the second more dangerous phase of COVID-19. It's when the lungs get inflamed that you go to the intensive care unit, you may need a breathing tube and additional therapies like steroids.
How does the city of Washington deal with something like this? You have the district's government, but the federal government, the White House, not really beholden to their guidelines and their regulations. We saw people that had exposure there at the Rose Garden ceremony last week, like Kellyanne Conway, speaking face-to-face to Bill Barr, the Attorney General, who on Saturday seemed to be ignoring quarantine guidelines. What kind of risks are we talking about with what appears to be a cluster there at the core of the White House?
Well, Roee, I think it's a recipe for disaster. You don't play with the devil in these situations. I think, as you mentioned, there is D.C., there are the states around. These lawmakers or the visitors who came to the Rose Garden, they're going all over, and each area has its own jurisdiction of public health. So contact tracing becomes a nightmare, and people need to cooperate for contact tracing to work. And I think as we look back in the future, this will be one large super spreading event.
Joe Biden was on stage with the president on Tuesday, earlier this week, Tuesday, debating with the president for 90 minutes, socially distancing, but there was space between them and obviously a projected voice. He's out there campaigning. Should he be quarantining?
Well, he doesn't really fit into the typical definition of exposure, which is less than 3 feet and for more than 15 minutes. But as you suggest, Roee, there were certain circumstances about this particular debate that made it a little bit riskier. It was indoors. There was a lot of shouting and screaming, high emotions, so possible aerosol generation. We would assume that the ventilation would be okay. But if I were Joe Biden and his staff, and I know that this will happen, he would need to be retested, because at the time he was tested, it's probably too early and could be a false negative.
And we should note his aides say he is continuing to be tested. Dr. Peter Chin Hong, thank you so much for joining us from San Francisco.
You're welcome. Thanks, Roee.